Welcome back to your coffee break, presented by Stratford Orthodontics on HANradio.com, streaming on the Hersam Acorn Network. John Kovach with Don Lang, Rob Adams, Andrew Frateroli, Joe Forlano on the controls. We are joined right now by Mary Swansiger. She is an RN, and she is a member of the Griffin Hospital Community Outreach and Valley Parish Nursing. You are also a certified diabetes educator and coordinator of the Diabetes Education and Support Group.
That's correct.
You've got a program coming up about how to manage your diabetes should you have it. Can you tell us about that?
That's correct. It starts this evening. It's called the Diabetes Self-Management Workshop. It's a 6-week program. It's 2.5 hours each session. So it starts tonight, the 14th, and it ends August 18th, 6:30 to 9 p.m. at Griffin Hospital. So we cover everything related to diabetes. It's a self-management workshop, and it's evidence-based. It was created at Stanford University in California. And basically, it covers everything that someone with diabetes needs to know. We talk about probably the most important thing and the most confusing for people is healthy eating, meal planning, counting carbs, looking at nutrition labels and figuring that all out, because that can be very confusing for people. We spend a portion of the first 4 sessions on nutrition. So we cover a lot of their questions. We also talk about physical activity and how important that is in managing their diabetes. We also talk about monitoring their blood sugars and what those numbers mean. What's normal, what's high, what's low. How can we keep it more in an even keel and avoid those extreme numbers? And what to do if it is too low and they have hypoglycemic symptoms. What types of remedy food should they have on hand? We also talk about sick day guidelines, what to do when they're sick and their blood sugars tend to be more out of control when they're not feeling well. So what to do about that. Working with their healthcare provider is also very important because, it's not just them. They're part of a whole team, a caretaking team. And this not only affects them, but it affects the family too. So we not only invite the person with diabetes, but also their close family members, because they don't live in a vacuum. When someone has diabetes, basically it affects the whole family. We also talk about medications, stress management, all kinds of action plans is another big thing.
What kind of symptoms should someone look for if they fear they may be diabetic?
The symptoms are very subtle. They come on very gradually, so they might not even know that they have diabetes. There's typically increased thirst, increased hunger, increased urination, but those don't typically happen unless the sugars are very out of control and they've had it for a while. So I think the best thing to do is that people should have their annual checkup and have their fasting blood sugar done. And if they're at risk for developing diabetes, if they're over 40, if they're overweight, if they have a family history of diabetes or a history of gestational diabetes, that's when a woman has diabetes during pregnancy. Any of those things, that puts them at greater risk for developing diabetes. Also, if they have high cholesterol and high blood pressure as well, the 3 conditions tend to come along together. They call it metabolic syndrome. So if any of those conditions are present, they really should be tested for diabetes.
Right. Now, it sounds like this workshop focuses mostly on type 2 because that presumably,
it's mostly for type 2. And also if people have pre-diabetes, that's the condition that comes before diabetes, they're also welcome to attend because it would be very helpful to them in preventing them from developing full-blown diabetes.
Okay. And how can... And you just mentioned on preventing the onset of type 2 diabetes. Now, what can someone do to avoid getting contracting it in the first place?
If it runs in the family, the best thing for them to do, you can't control your genetics,
Right.
but the best thing you can do is keep your weight down. Keep it at your ideal weight. And even if someone is overweight, if they, lost a few pounds, that would be tremendous in helping delay the onset of diabetes. And studies have shown, even a 5 to 7% weight loss would be beneficial in preventing diabetes.
And what are the dangers in leaving it untreated?
There's a lot of complications that diabetes can lead to if it goes untreated or not treated well enough. And they include blindness, lower limb amputation, retinopathy, kidney failure, heart disease, stroke. So the list goes on and on. Basically, it affects every part of your body.
So the workshop meets Tuesdays, 6:30 to 9 p.m. from tonight through August 18th.
Yes, and they have to register.
Still time
and
to do
there's
that?
still time. We have a few spots left. So they can call me. The number is 203-732-1137. They can call to register. Or if the timing of this one doesn't meet their needs, they can always go on Griffin's website, griffinhealth.org, for future classes, because we're always running them.
I was going to say, how often do you offer the Livewell Diabetes Self-Management Workshop?
Very often. We started these programs last January, and I think this is the 12th workshop
Oh,
that I'm
wow.
running. So it's
fairly
fairly
it's
often.
regularly.
It's very regular, yes. Yes. And we run them during the day and also during the evening, so to meet the needs of the people.
I've seen a few instances where getting together with people who are undergoing a similar procedure or might have a similar ailment, that getting together kind of helps them feel better about going through with it and managing it. Do you find that with the Livewell Diabetes Self-Management Workshop?
Definitely, definitely. I think they feel that they learn that they're not alone, in handling this condition. It's so common, and it's a safe place for them to talk about it, And this program is very interactive. It's not just me talking the whole 2.5 hours. It's very interactive. People participate, and they help each other.
And it meets
Yeah.
at the hospital?
Yes, yes. This one meets at the hospital. We've had programs at other places, at churches, at community centers, at doctors' offices. If I can get a group together, at least 10 people, I could pretty much hold the group anywhere. It's very, very portable.
Right. And I just wanted to mention, you had mentioned that some of the other programs that Griffin offers, I'm just looking at some of this information here. There's also Livewell, chronic disease management, depression, heart disease, arthritis, pain and anxiety. So it's a fairly comprehensive outreach to the community that is happening here.
Yes, definitely. We run a number of programs. The chronic disease program works well. It's really beneficial for anybody with any chronic disease, like you mentioned, anxiety, depression, heart disease, cancer, pretty much anything. And there's a lot of commonalities with the different ailments and conditions and what they're dealing with. So that's what we talk about. And then the diabetes one is, it's got a life of its own. And there's just so many more specifics with managing diabetes. That's why there's a separate program for that.
Is it more prevalent today than it was 10 years ago?
Diabetes, oh yeah. It's becoming more and more widespread. People as a whole, us Americans, were getting heavier and heavier. They even coined a new term, diabesity. And they even changed the names of diabetes. When I was in school, we had juvenile onset diabetes and we had adult onset diabetes. But now, younger and younger people are developing what used to be adult onset diabetes. So they actually changed the names to type 1 and type 2 diabetes.
Fascinating how it's changed and how it's a reflection of the lifestyle. Okay, so that group starts tonight, 6-week program.
And it's free. I didn't tell you it's free.
It is free.
Best part?
Website they can go to for information?
griffinhealth.org.
And that is the Livewell Diabetes Self-Management Workshop. Mary Swansiger from Griffin Hospital, thanks for joining us on Coffee Break. We will be right back with more of the day's news.